everyone. Today we'll start about physical examination. Definition of physical examination. It is the systemic collection of objective information that is directly observed or is elicited through examination techniques. It indicates we are collecting systematically information by observing the patient as well as we are doing examination and we are identifying. We'll see about the purposes. First one, to understand the physical and mental well-being of the client, to detect diseases in its early stage, to determine the cause and extent of the disease, to understand any changes in the condition of the disease, to determine the nature of the treatment or nursing care needed for the client, to safeguard the client and his family by noting the early signs, to contribute to the medical research to find out whether the person is medically fit or not for a particular task. Techniques of physical examination. There are four basic techniques which are used in physical examination or explained as follows. First one, inspection. Second, palpation. Third, percussion. Fourth, auscultation. Fifth is manipulation. By doing these all techniques, we can identify whether the person is physically, mentally, whether a person is having any problem. First one, inspection. It is the systematic visual examination of the client, or it is the process of performing deliberate purposeful observation in a systematic manner. Next, it involves observation of the color, shape, size, symmetry, position and movement. Next, it also uses the sense of smell to detect odor and sense of hearing to detect sounds. Means by visualizing by our eyes, we can identify the person whether having any problem. In the example in skin, any changes of the color of the skin, or in eyes we can see when you are inspecting any jaundice or not, that we can be identified. Next one, second, palpation. It is the use of the hands and fingers together information through touch. It is the assessment technique which uses sense of touch. It is feeling the body or a part with hands to note the size and position of the organ. When we are doing the palpation with our finger, index finger and middle finger will be palpating through the touch, and you can identify any organs like splenomegaly. Okay, any organ enlargement is there, liver enlargement, spleen enlargement is there. By using this palpation, you can be identified. The hands and fingers are sensitive tools and can assess temperature, turgor, texture, moisture, vibrations, size, position, masses and fluid. As well as the enlargement, you can be seen any fluid is there with the help of the palpation. And the texture, color, temperature, everything you can be identified with your palpation. By touch, you can be identified. Next, the dorsum, that is the back surface of the hands and fingers, are used to measure the temperature. The palmar, that is the front surfaces of the fingers and finger pads, are used to assess textures, shape, fluid, size, consistency and pulsation. Vibration is palpated best with the palm of the hand. Next is the third one, percussion. It is the examination by tapping the fingers on the body to determine the condition of the internal organs by the sounds that are produced. Means by using the index finger, okay, with the help of the dominant hand, index finger, with the other hand we will be keeping and we are palpating. Percussion is the act of striking one object against another to produce sound. The sound waves produced by the striking action over body tissues are known as percussion tones or percussion notes. Percussion is also used to determine if a structure is air filled, fluid filled or solid. Okay. The degree to which sound propagates is called resonance. Percussion produce the characteristic tones such as tympanic, hyperresonant, resonant, dull and flat. Hyperinflated lung tissue, that is the hyperresonant. Normal lung tissue, if you check percussion, it will be resonant. In the liver, dull, bone flat. Okay, these are the how the characteristics. Next one, auscultation. It is the process of listening to sounds that are generated within the body. It indicates while you are checking with your ears also. Okay, you can be identified. If you keep your place your ears in the abdomen, you can be hear the peristaltic movement, and also with the help of the stethoscope you can be hearing. Auscultation is usually done with a stethoscope. The heart and blood vessels are auscultated for circulation of blood. The lungs are auscultation for moving air, that is breaths. Okay, when we have a dull wheezing sound, this everything you can be heard with the auscultation, that with the help of the stethoscope only. The abdomen is auscultated for movement of the gastrointestinal content, that is bowel sounds, peristaltic movements are there or not. Next one, the character of sounds are assessed by auscultation or pitch, that is range from the high to low, loudness ranging from soft to loud, quality, that is gurgling, duration, that is short, medium or long duration. Last one, manipulation. It is the moving of a part of the body to note its flexibility. Limitations of movement is discovered by this movement, where the person can lift their body, that is any hands, legs. Okay, that you can be identified. Testing of reflexes, that you can be done with the help of a knee hammer. You can be checked. The response of the tissues to external stimuli is tested by means of a percussion hammer, safety pin, wisp of a cotton or hot and a cold water. Thank you for watching. Have a nice day.